afternoon. My name is Elizabeth Bierbaum and I'm going to talk about an issue that is always present in psychology. The issue is ethical decision making. The specific topic that I'm going to be discussing throughout this presentation is when a psychologist is dealing with an underage patient suffering from an eating disorder. To whom does the psychology owe the fidelity? To the patient or to the parents of the patient? As a psychologist, having the determination to help someone suffering from a life-threatening disorder such as anorexia, bulimia, or binge eating disorder may arise several problems when making decisions in the patient's treatment. If the patient in treatment is underage or refuses to be treated, there are several conduct codes that a clinician should follow. The decision making should always be based on principles and ethics. Suffering from an eating disorder is not easy at all. The patient could experience anger, frustration, embarrassment, and many times denial of the illness, making the situation a hard one to manage and resolve. There are many situations that might trigger a psychological disorder that might end up causing an eating disorder like anorexia, bulimia, or binge eating disorder. I was a patient with anorexia nervosa diagnosed at age 13. And when I started my treatment, I was always asking and making sure that my psychologist would not let my parents know about the things that I used to tell him in therapy. I always thought of my psychologist as a person that I could always trust, no matter what. Personally, I think that was one of the reasons why my treatment was successful. However, when the patient is too depressed or is having suicidal thoughts, psychologists should alert not only the parents but the pertinent authorities also, because they should follow the conduct codes and it's also the ethical thing to do. This leads me to another important question. If the patient feels that he cannot trust her psychologist because the psychologist is giving all these red alerts in which the patient enters in distress and shuts himself off, wouldn't be this worse for the patient? What is a real pertinent and ethical way of acting for the psychologist to really help in the patient's recovery? Therapeutic relationship is an important factor that makes therapy work in a proper manner. We're talking about 30% of the success of the therapy is based on the relationship of psychologist with the patient. When a teenager is suffering from an eating disorder and she feels that the parents cannot be trusted for different reasons, psychologists should be the ones providing support and should have the capability of inspiring that trust that many patients, especially teenagers, need. A very important question to discuss is exactly under what circumstances does the psychologist is allowed to break their confidentiality. It is important to maintain a clear head and a high level of ethic when treating a patient that is suffering from an eating disorder or any other psychological problem. Avoiding bias is an important thing as well. There are exemplary group psychological biases, for example, conformity biases, and there are also individual biases, for example, stereotypes. It is important to understand that the decisions made by psychologists and doctors have consequences for their patients and relatives also. For this reason, psychologists should be very careful and try to be as accurate as possible when giving a diagnosis and a possible treatment for a patient suffering from an eating disorder.